everyone. My name is Gisha Armelia Faradiba, student of Information System at Bina Sarana Informatika University with student ID 19252512. And today I will present my midterm assignment, which is a journal review, and I will present and review two papers related to healthcare innovation. One about digital platforms of healthcare system, and another about mobile health adoption in Indonesia. Let's get started. The first journal I want to review is Methodological Toolkit for Analyzing the Attainment of Regional Healthcare Systems Target Indicators, written by Yashina, Oksana Kashina, Konstantin Yashin, Natalia Prashanova Rupstova, and Alexandra Vilskiakova. So the purpose is to develop a methodological toolkit for automated analysis of regional healthcare system integrated with the electronic budget state digital platform aims at real-time monitoring, timely decision-making, and strategic development of healthcare systems. And the methods they use for that journal is data search, Russian Treasury, Ministry of Finance, and Federal State Statistic Service. And two is indicators standardized to 0 to 1 scale, composite indicators, IFCR, financial research, and TI, or target indication. And the last is cluster analysis. They got 9 development strategies. And for the results, from 9 categories is from highly sustainable to crisis conditions. For example, Yamal Nenets and Chukotka, they are the highest sustainability Ivan Diva crisis, and most regions fall into intermediate categories. And summary, Toolkit automates monitoring and classifications, supports documents data-driven interventions and strategic planning, and demonstrates IT role in healthcare governance. And the results show that the toolkit successfully highlights differences in healthcare performance across regions, and it enables policymakers to detect weak areas, like allocate resource more effectively and design targeted interventions. And this paper is innovative and valuable, but requires minor corrections for clarity and consistency. And overall, the toolkit is not just an academic concept, it has really potential to improve healthcare outcomes if applied consistently across regions. There is advantage and disadvantage. For advantage is real-time monitoring system, integration of diverse data source, clear classification into 9 strategies, and supports transparency and accountability. But it has disadvantage, like complex methodology. It's difficult for non-technical readers and inconsistent reference because it focuses on Russian data and lack of practical case studies. Okay, next move to the second journal is the influence of trust, health belief, and technology acceptance on the intention to use mobile health in Indonesia, and empirical study of users and non-users. The writers is Sheila Amalia Salma, Arya Widyanti, Khairul Muslim, Titis Wijayanto, Fitri Tropsilawati, Hilya Mudrika Arini, dan Adi Dharma Wibawa. And the purpose of this journal is to examine the influence of trust, health beliefs, and technology acceptance on mobile health adoption, compare users versus non-users to identify key influencing factors, and provide insight into cultural, psychological, and technological aspects shaping adoption. And the methods they use is survey of 616 respondents in Bandung, Yogyakarta, and Surabaya, purposive sampling to ensure representation, questionnaire based on TAM or TAM, HBM, and trust constructs. There are 34 items and reliability tested. So the results they got is significant factors, perceived usefulness, ease of use, and health of risk. The trust, like not significant, and the differences for non-users, they got influenced by usefulness, and users influenced by ease of use, and health consciousness people for users, health risks relevance for non-users. Okay. And the summary study applies TAM and HBM in Indonesian content, shows usefulness, ease of use, and health risk drive adoption. Trust plays a minor role and provide insights for policymakers and developers. And yeah, they have this advantage and disadvantage. And for advantage is empirical evidence of mobile health adoption in Indonesia, applies time and HBM in new cultural contexts, distinguish between users and non-users, practical guidance for app developer, and support policymakers in digital health initiative. So the advantage is limited to 3 cities, not fully representative, and reliance on self-reported survey data, just not significant, like unexplored cultural reasons, and focus only on intention, not sustained usage, and no discussion of infrastructure challenge. And for example, if people think the app is easy and helpful, they are more likely to use it. But if they don't trust it or worry about risks, they hold back. They can hold back. And interestingly, users and non-users are influenced differently by these factors. So this paper gives valuable insights into mobile health adoption in Indonesia. More importantly, this research provides a foundation for designing better mobile health solutions in Indonesia, and developers and policymakers can use these insights to build apps that people truly want to use. So, all right, to wrap up today's presentation, we've looked to important studies. The first one showed how digital platforms can strengthen healthcare systems at the regional level and giving policymakers better tools to monitor and improve performance. And the second one explored how trust, beliefs, and technology acceptance shape people's willingness to use mobile health in Indonesian, and reminding us that adoption depends not only on technology but also on psychology and user trust. And together, these papers highlight that healthcare innovation must happen at both levels, like system wide and individual. And by combining strong digital infrastructure with user-centered design, we can move toward a healthier and more connected future. So thank you for your attention.